First, I wanted to discuss the results that I had on the leadership/manager questionnaire. A little bit surprised at the results, to be honest with you. I scored very high in the interpersonal section and high in the administrative and conceptual sections, which would, in theory, indicate that I would be a somewhat good candidate for a manager. I really do find this a little strange, as I have never considered myself to be manager material, nor am I interested in pursuing anything like that at this point. But it is good to know that I have some of those qualities and that I can hopefully apply those to my nursing practice and use those perhaps to inspire my colleagues around me. Several of the items listed that I scored really high in and had no hesitation at all answering on, and that's included that I worked well with others, I was really good at problem solving, I didn't mind speaking with people about their concerns and trying to address them. All of that very much so in my nature, as I have just recently taken on a leadership type role in trying to inspire some collaborative work with our department. One of the items that I scored really low on actually is managing people's resources, and listing that as a strength. I do not feel that managing people or resources is my strength right now, as again I am very new to the leadership role and am trying to learn as I go. I'm trying to apply everything that I learned, especially with this particular class. Some of the characteristics that are needed for management, I do feel that I have a few of them. You have to be really good at planning things. I am very meticulous about details and try very hard to plan things out and try to troubleshoot what I think the problems might be as I present to a group. You need to be really good at organizing things. I am a guru on organizing much of anything. If you ask anybody in the department, they'll tell you that. While I was going through nursing school, I actually came up with a very specific form that I used throughout the clinicals and actually continued using when I was first on the floor, so that I could keep up with everybody's care, and it really did help me know my patients. I am very proud of the fact that I actually had several of the nursing students who had asked me for a copy of that form so that they could use them. I feel that I am very good at inspiring people and motivating them. I know both of those things very much so needed as far as a leader is concerned. Managers should be able to do the same thing as well, if not more so on a larger scale, as they are actually responsible for the departments and they have to answer to the higher ups. Another thing that I feel that I am really good in, still need to work somewhat, because my communication skills are pretty good. I feel like I get my point across. I try real hard to watch my tone. I try real hard to listen to what the other person is saying. All of those things very much so needed as a manager. To discuss what type of integration I would use, I actually think that a combination of the horizontal and vertical integration with the manager models is actually beneficial, as actually collaborating with your colleagues, and that my fellow nurses, my fellow technicians, really helps to move through a problem and help solve it. It allows everybody to contribute to the conversation. It allows everybody to contribute to the potential answers, and that this would be another thing that the book refers to as shared governance, where decisions are actually made jointly, and it inspires leadership throughout a unit or throughout an organization. Our department actually is recently moving in this direction again, as our managers feel that joint effort in the department would be better than from the top down. The thing is with the shared governance, however, that each individual person is still accountable for their actions, and with this, the managers are actually expecting you to step up and take responsibility for anything that you do, be it right or wrong. Our organization actually is very big on comprehensive holistic care that addresses both immediate and future needs, and we have embarked on a joint venture with UNC Healthcare to try to address this. The new allocation of resources that are available to us across the state include evidence-based practice, research, implementation, standards of work, that are all designed to ensure quality and safe care is being provided to the patients, and also is being shown to improve overall satisfaction amongst not just the patients, but to staff as well, as everybody feels like they are contributing, and with not only treating the the illness with the patients, but promoting wellness through education that is provided through interventions, through treatments, through referrals with other doctors and available throughout this particular system. The team nursing model is actually what is used in our organization currently, which of course involves a collaborative effort on nurses, the aides, in my case the nurses and surgical technicians, anesthesia, and that to provide safe, effective care for our patients. Believe that this particular model again is extremely beneficial as it mirrors shared governance and actually allows everybody to participate in the care for the patients going across the continuum, be it from start to finish. That being said, this is very much so a form of the transdisciplinary care model, and that brings me to the article that I actually came across. The name of it was Outcomes of Clinical Nurse Specialist Role, Transformation to Population-Focused Population-Focused Model. This particular study was based on the effectiveness of implementing the use of a transdisciplinary team to manage cancer patients across the continuum from start to finish. The benefits of this particular model showed that as this transition occurred from one type to the population-focused model, again involving the transdisciplinary teams, it allowed for quote, significant improvement in decision making, support of leadership, and positive contributions to patients and staff, resulting in improved nursing sensitive patient outcomes. It's end quote. This survey also showed that there was an increase in satisfaction overall with the patients and the staff, and that they really felt that they were contributing to outcomes via evidence-based practice, research projects, and felt that there was a lot of growth that took place amongst the clinical staff. The takeaway that I took from this particular study was that transdisciplinary models are very, very effective opportunities to incorporate improved patient care and satisfaction. And at the end of the day, this is what all of us are trying to improve patient outcomes, to improve the plan of care, and to ensure that they really are getting the best care possible. It is our responsibilities to advocate for these patients and to advocate for the staff as leaders and as managers, and using these models and very good skills and communication, all of this can be done. Thank you for listening.